Okay, let's talk really quick about that demo. So the toe touch demo showing the law of reciprocal inhibition as it presents in the clinic. So does this mean that everybody with tight hamstrings just needs to have that done? No. Does this mean that that's the only condition that this works with? No. The law of reciprocal inhibition works with every patient that has an issue with that functioning on the normal level. So you're going to see a lot of this happen with lower extremity patients, low back pain patients. So low back pain with a toe touch during the functional screen tells me I need to check pyramidalis, which is the muscle that I treated in that scenario with the toe touch kid, because they have hyper-reactivity of the extensors when they should be going into flexion being controlled by the flexors. So if we don't have pull here causing reciprocal inhibition of the other side, we're going to have tightness on the other side. So every time a patient comes in and tells you they have low back pain when they tie their shoes, that is not a low back problem. That is a most likely lower abdominal problem. So this is something that you should be using every single time you treat a patient. If you're not using the law of reciprocal inhibition, especially with plantar fasciitis, low back pain, patellofemoral syndromes, hamstring pulls, anything to do with lower extremities, you are wasting a ton of time chasing your tail, trying to chase gimmicks and make people feel better when the way you make them feel better is to get rid of the root cause of the problem, which is neuromuscular inhibition. And that's manifesting itself as tightness on the opposing side because of lack of reciprocal inhibition. So what I did when I was talking, I was facilitating his pyramidalis. Pyramidalis is the small little muscle that attaches to your pubis and attaches to the linea alba on the other side and pulls the linea alba tight. So if that is not tight, your abs have a really hard time anchoring to anything. As soon as you can get that pyramidalis to pull linea alba tight, abs kick in, rectus kicks in, transverse abdominis kicks in, internal external obliques kick in, does a whole bunch of stuff in one shot and fixes a lot of problems. And when you know how to do this, makes you look like a super genius, and your patients, I promise you, will look at you and say, what the hell did you just do? Especially your patients that already went to Joe Blow down the street that stretched their hamstrings, put them on stim, put them on heat, gave them some stupid corrective exercise, and all the other PT, chiropractic, massage, mumbo jumbo crap that has absolutely nothing to do with physiology. So this demonstration was a quick demonstration of a small snapshot of what I did with that patient. He's actually coming in for an AC separation, grade 3 AC separation, which he's all better now. This was, I think, the third week after he had the separation, so he's back to lifting and everything now. But I know that he's got a history of other stuff, so I always check everything, and when I checked his toe touch on his screen when he came in, complained of tight hamstrings, and his toe touch was tighter than normal. So gotta treat everything, gotta assess everything every single visit. So let me know what your questions are as far as law of reciprocal inhibition, what I was doing with palpation, neurophysiology. The really nice thing is once you join the MemberShift, you're gonna get an hour-long talk with me going through neuromuscular physiology and going through the law of reciprocal inhibition on the board and showing you what afferent and efferent nerves do, what muscle spindles do, what GTO does, what nuclear bags are doing. So we're gonna run through all that stuff, because if you don't understand those little things, you don't have a clue what you're doing when you evaluate patients or when you treat patients. You are just chasing your tail, doing old school crap, looking at symptoms, trying to figure out symptoms, and that's why you're frustrated. That's why you're stuck. That's why you're going to be burnt out faster than you know. So when you're ready to learn how to apply neuromuscular physiology with all patients and make everything make a lot of sense and make your job really easy and make yourself look like a super genius, you need to join the shift and learn how to do that with everybody across the board. Doesn't matter what your setting is, what your patient population is, but I guarantee you, if you learn how to do that with athletes and you want to work with athletes, you will have every athlete in the area on your doorstep saying, I want you to do that to me. So, questions below, talk to you later.